Hello everyone, a very warm welcome to all. And today we'll be discussing about. I'm Dr. Pankaj. I am a consultant at Apollo Cradle Sector 82, and we'll be discussing today about the general newborn care. So it is something which is very important as a new parent. We are always worried that what all things are normal and what things should be done, and as you know, few things are there which you may feel that baby is having some difficulty or some abnormal behavior, which may be normal for that age. So it is important that you understand what are the normal things, because it is a transition period for the baby also. And so if you know what are the normal things, you will be in a better position to understand. So coming to the newborn care, so as soon as a baby is born, so most of the times they are delivered in a hospital. You will have a pediatrician who is looking after the baby. So the pediatrician will take care of few things like these days we do delayed cord clamping, so that the hemoglobin, that the blood that is coming from mother to the baby is coming for some more time. That helps to build the reserves of the baby, so that there is less chances of anemia. And it is like a clean cord cut so as to prevent any infection in the umbilical cord. And also, uh, so first and foremost thing is, as soon as the baby is born, baby is crying, if baby is healthy, so baby will be given to you. Okay. So now when baby is with you, you have to start with the feeding. That is the first thing that you should start. And it is advised that we start feeding within half an hour as soon as baby is with you. In normal deliveries, we generally tend to start feeding immediately after birth. So as soon as baby is born, it is given to the mother's lap, and she can start feeding even when the further process of delivery is going on. So that is very essential that we start feeding early, so that you start getting milk production starts. This is a normal physiology. So the sooner you start feeding your baby, the more milk will be there, as it is a normal physiological response that the milk will be formed when it is required. So if baby is crying and you start feeding, that sucking reflex will send the signals so that the milk production starts. So it is advised that we start within half an hour of normal birth. And even in cesarean sections, it is advisable that we start breastfeeding at least within 4 hours. That should be our window period, so that within 4 hours we are starting with the breastfeeding. And second thing is birth vaccination. So most of the times when the baby is given to you, so before that baby will be vaccinated for the birth vaccinations. There are three vaccines that are given. First is BCG. So it is given on the left deltoid muscle and left shoulder. So it will develop a small blister in around 2 to 3 weeks. Initially there is no mark, but after 2 to 3 weeks there will be a small blister that will be formed at the site of vaccination. So it is painless, harmless, and you should not worry that it is appearing like some uh, boil or something. But this is normal physiological thing. It will happen. That shows that the vaccine is given properly. So it will develop into a small blister, and over the time, after around 2 weeks more, around 6 to 12 weeks, 6 to 10 weeks, it will rupture, and it will leave a scar. So that BCG mark you can see on everyone's left hand. So that will be like a permanent thing. And BCG protects from the tuberculosis. So it prevents doesn't allow the serious forms of tuberculosis to manifest, like mainly tubercular meningitis, which can have long-term brain issues. So that is the one. Second is oral polio. So that is given at birth, and hepatitis B. These three vaccines will be given, and they are mostly given before the baby is given to you, and along with a vitamin K injection, which is also given at birth. So these things will be done before the baby is delivered to you, so that it is not missed. Then it is very important that you maintain the temperature. So temperature maintenance is a crucial part which you should consider in a just born baby, newborn baby. So if a baby is normal, healthy, like 2.5 kg is the normal weight that we expect. So if baby is more than 2.5 kgs, that is a good weight. So good weight baby who's healthy, who's having no other issues. So you should not be too worried, especially in the warm weather, that baby will have no issues as such. So you should keep temperature which is convenient for you. So if you are feeling warmth, the baby will also be feeling the same thing. So it is advisable to keep temperature between 26 to 28 degrees. So that is the room temperature. And you should have almost 2 layers of clothing. That is sufficient. And too much overwrapping is also not advisable, because that will result in increase in temperature. So you will feel that baby is having fever, even if you check it with thermometer. So it will be high because you are doing overclothing. So it is always advised that keep almost similar level of clothing as you are having, and just a simple wrap extra, that should do. And also we should take care that in winter days it is definitely important that we adequately cover with a woolen clothes, and we should have a warm blanket. To check whether the temperature is okay or not, you can always touch the feet and body of the baby. So feet and hand should be, you should feel with your back of your hand. So when you're touching it, you will come to know that they are warm to touch. That means the temperature is fine, and they should be looking pink. So a pink looking feet and warm to touch is a sign that the temperature is perfect. If it is showing some cyanosis, it is blue, then that doesn't that shows that baby is having some cold stress. Also, if they are cold to touch, that also shows that you should increase the layer of clothing. And if you feel that the baby is sweating or the temperature is high increasing, then you should just open up one layer, so that that extra heat is exposed to the air. So this much thing will guide you that if the feet and hands are warm to touch and they are pink, so that is the best thing that you can do. And if they are warm, if they are cold to touch, or if they are blue, then you have to increase the layer of clothing. Okay. So you should be knowing what are the normal things, like we have discussed about feeding. So we say it should be on-demand feed. On-demand means whenever baby is making cues that baby is hungry, like putting his hand in the mouth and just making the sucking movements, crying, and searching for breast, trying to move head towards the breast. These are the signs, cues that baby is hungry, and you should start at this time only. So the earlier you pick up these things, you will be able to achieve better latching. Baby will be sucking better, and there will be a better feeding. And we also say that, but take care that if baby is sleeping for too long, like if 3 to 4 hours have passed and baby is still sleeping, so you can like actively wake up the child and feed. And during feeding, it should be a feed of around 15 to 20 minutes at least, because the content of milk will vary. Initially, milk is like more watery. It will contain more of minerals, and water content is high. But as we like, if you're feeding for around 15 to 20 minutes, so the later part will be, the hind milk will be thicker. That contains fat more. So baby needs both. Initial, the carbohydrate containing, lactose containing watery milk is also important, and the hind milk is also important. So which comes after around 15 to 20 minutes feed. So we say if the baby is sleeping before the feed has started, you should always keep on stimulating the baby. So you can just tickle behind the ears or tickling on the feet. So by that way, baby will be able to stay awake, and you can feed for around more than 15-20 minutes in a single episode of feeding. So that will take care that baby is getting both the milks, and after getting the hind milk, baby will feel the sense of fullness, that satiety, that baby is full, and he will sleep for a few hours, 2 to 3 hours, before getting irritable again. So that is very essential. Okay. Then coming to what all things are normal. We generally see that baby is sneezing or some hiccups. These are normal activities. We should not worry about that. Then next is about red rashes, or few rashes are there, spots are there on the body. Even that is normal. and there are sometimes few white spots on the nose. These are all normal rashes. They will disappear with time. They are not harmful for the baby, and you need not do anything for that. So it may be more rashes in few babies, which may require some attention. But most of the babies will be having it weaning and coming again. So you should not worry about that. Coming to like bowel movements and urine output. So it is important that you understand that passing how many times baby is passing urine is adequate. So we say in after around 3 to 4 days, baby should be passing around 5 to 6 times urine in 24 hours. If your baby is passing urine more than 5 times, 6 times in 24 hours, more than 6 times is a very good urine output. You should not be worried after that baby is getting feed or not getting. And if baby falls asleep for around 2 to 3 hours post feeding, that again is a sign reassuring that baby is getting good amount of milk that made him sleep for a pretty long time, for 2 to 3 hours. Baby is sleeping after feeding. That shows that baby received adequate amount of feed. And regarding stools, like passing a number of times baby is passing potty, so it will vary. It is variable. Few times you will see that after every feed, baby is passing small amount of stool. So it may be around 8 to 10 times also in a day. Even that is normal. And sometimes it will be like baby is not passing stool for maybe 2 to 3 days also. If baby is feeding well, there is no discomfort to the baby, and if the stools are soft, then you should not worry. Even passing stool in 2 to 3 days, even 4 days, it's safe. It's normal. So you should not worry that baby has not passed stool after 1 day and you get worried. So it is something which is physiological. You need not do anything for that. And so this is like a normal pattern of passing stool. And you may feel that there is some opening in the front of the head. So that is like a soft area which is open, so that the brain is growing. The bone should be free to grow. So it generally closes around 9 to 18 months. So having open or soft area in the anterior fontanelle over the head is also normal. We should also not worry about that. Okay, and one more common concern that we generally see is yellowish discoloration of the skin, that is jaundice. So you will see that many babies are developing jaundice in the first week of life. That will increase in initial 7 to 10 days, then it will start to come down. So it is very important that we pick up the jaundice at right time. It should be followed up regularly. We should not miss when the jaundice is increasing. And once we have achieved that it is not increasing any further, then it will be safe to not monitor it again. But initial 7 to 10 days is the time then when it should be routinely followed up. And to prevent jaundice, it is again, you have to feed frequently. The more you feed, more of it jaundice will be excreted. And also it is important that you adequately we can keep baby under sunlight for 15 to 20 minutes. That will not just help in some reduction in jaundice. It will not reduce the jaundice a lot, but it will help marginally. And also it is important for development of vitamin D. Again, not enough to take care of the daily requirement. So it will be advised whenever you are discharged to give a vitamin D drops. That should be given daily. You should give around 400 IU units that will be prescribed to you by your doctor at the time of discharge. That should be given regularly. So that is something which is required this much amount is required on a daily basis. And there is no other source of vitamin D. So you have to supplement it. It has to be given as a medicine only. Then next common thing that we see is spitting. So baby may spit out some curdled milk or even a fresh milk whenever you have given feed to a baby. So some amount of curdling, spitting is normal, because the reflux mechanism is not very good in the newborn babies. So over the time it will improve, and you will see that around by 3 to 6 months it will improve quite a lot. So what can be done to prevent regurgitation? And so it is advised that after every feed, when you feed your baby, you should give burp. So burping is nothing, just you keep baby upright on your shoulders and giving a pat. You can do it like from below upwards, and or just patting the back, so that all the air that is swallowed along with the milk, that comes out. And whenever you put baby, like make them lie down, they will not regurgitate the milk. It will not come out. So again, like burping is advised, and it should be done intermittently if baby is on breastfeed. So after every breastfeed, it should be given, even during the night hours. It is very essential. Then we also come across, as baby grows around 15 to 20 days, baby will have some colic. Colic is nothing but just some the child will be crying, fussy, and there will be some bloating of the stomach with baby passing gas. So it is also harmless. You should not worry a lot, and most of the time it will just subside by when you rock your baby softly and taking in lap. As soon as you put baby back on the cot, baby will start crying. As soon as you pick up the baby in your lap, baby will be comfortable. So that can be done. And if it is excessive colic, which is not controlled by just simple measures, then you may have some medications which are given. So they will be prescribed by your doctor. So you should not worry about that. And coming to the sleep, it is very important that baby is sleeping well. So because while they are sleeping, they are growing, their brain is developing. So sound sleep is very good, very essential for the baby. And generally they sleep for around 14 to 18 hours. So they will just wake up, take feed, and then go back to sleep. So this is like their normal cycle. They will be doing on a regular basis like that. So sleep is very important. So always try to make an ambient environment where the temperature is favorable. It is not too cold, as I mentioned, 28 to 26 degrees, 26 to 28 degrees. Ensure that there is not too much of light. It should be noise free, and it is also, some babies do like soft relaxing music also. So that can be played for a few hours, like 1 to 2 hours, not more than that. Overstimulation is also not good. So playing a soft music is also helpful. And regarding the cord care, umbilical cord, so you should just take care that no specific care is required. It should be kept dry so that there is no infection in that. So just keep the umbilical cord dry. It will separate off in around 7 to 10 days. So once it is separated, then you can start giving bath to the baby. Also before that, just sponge it with a dry sponging, or just by soaking a soft cloth in the water and cleaning the baby. So just sponging is adequate, because most of the time we are changing the diapers, and so diaper area is cleaned on regularly. So there is no need to bathe the child regularly or sponging too frequently. So just sponging with the clothes once a day is sufficient till the time the cord has fallen, and it will take around 7 to 10 days to umbilical cord to dry and to separate. Okay, and you should also know when to seek help. So if baby is dull, lethargic, is not active, not sucking properly, these are the signs that should alarm you. So if you see that baby is not taking milk properly, not sucking well, is too dull, lethargic, and making some abnormal movements like some conversions, and if there is fast breathing, rapid breathing, generally they have periodic breathing. So whenever you see even a normal child will have a episode of fast breathing, like it will be for few seconds, the breathing will be too fast, then they will take a pause, then there will be some slow breaths, then it will again be fast breathing. So it is like periodic breathing. That is a normal pattern of breathing. But if it is continuously and it is very high, or if you see that there's some extra sound while the child is breathing, these are the alarm signs that you should consult a pediatrician. And if you see that the jaundice is very high, as the jaundice increases, it will start progressing towards the legs. So if you see jaundice below the navel, that time you should visit the pediatrician. And whenever you see that, as I said, some regurgitation is okay, but if the child is vomiting each feed, or if it is a yellow vomiting, bilious vomiting, we say, so that is like alarming again. So if the child is having too much of vomiting, not having adequate feeding, dullness, and fast breathing, these are the signs that should alarm you to seek medical advice. And it is advised that you should not delay in all these things. So coming to feeding, which is the foremost and most important part in the newborn care, rest all things can be all things will be done secondly. Most important is the breastfeeding. So as we know, breast milk is the most best milk that best food that the newborn can get. It contains all the nutrients in the best way, which are abundant, which are easily absorbed, and which are containing other things also, which will not be there in other milk. Like if you are taking some formula, that will contain the all the proteins and carbohydrates, but it will not contain other important ingredients like antibodies, antioxidants, which are there only in the breast milk. So as they contain the all the nutrients in exact amount, it is good for the baby's growth. And to optimize the baby's brain development, it is advised that you give exclusively breastfeed the child till 6 months of age. There is no role of any gripe water, no role of any honey water. So till 6 months of age, baby should be on exclusively breastfeeding, that you are giving only and only breast milk to the child. There are many advantages of giving breast milk. As it contains antibodies, there will be lesser chances of infection to the baby. We see lesser chances of diarrhea, less respiratory infections, less ear infections. There is also a less chance of, they will also has less chances of developing allergies, asthma in later in life. And also it protects the child from long-term diseases like obesity and diabetes. So the incidence of diabetes and obesity will be lesser if the baby is exclusively breastfed till as long as possible. It is advised to give breast milk to up to 2 years at least. Sorry, but exclusive breastfeeding, that is you are giving only and only mother milk till 6 months of age at least. After that, weaning can be started. Complementary feeding should be started. That is, you are giving something additional along with the breast milk. So breast milk will continue even after 6 months, but the extra food will keep on increasing with the time, because the mother milk will start decreasing in amount, and the requirement of baby will be higher after initial, maybe after 6 months. So these are the benefit to the baby. It is not only for the baby, mother also gets many benefits, like there's lesser chances of some cancers, breast cancer and ovarian cancer in the mother. There will be a better weight loss in mother. Also, it will, most important, it has to form a bond between the baby and mother. So it is both physical bond as well as an emotional bonding. So when you feed the baby, it is like falling in love with your baby. So the more time you spend with the baby, the more you are having a better bond with the baby, and baby is always with you. So it is again helpful for both. Mother will be more confident, lesser chances of postpartum depression, and baby is more comfortable, less crying. So it will be easy for you to handle also, and also you will feel much more confident while handling. While handling, you should take care that you are very gentle with the handling. If you are handling a newborn, there's always a chance that you may get the baby may. So always support the back, head and neck of the baby. So if you're supporting the head and the neck, then it is easy to handle the hold your baby. And it is advised that you should not rock too vigorously, because there is a chances of intraventricular bleed, that is brain bleeding inside the brain. So it is always advised that you should hold the baby gently always. And it is always good that we wash our hand before handling. so that there is less chance of infection, because immunity is weak in newborns, and we can transfer the infection from your hand to the baby. And also, whenever you are like carrying your baby in stroller, or it should be fastened. The seat belt should be properly fastened. Even when the baby is traveling in car seat is definitely better. And for bonding, like it is both physical bonding and as well as emotional. So for that, you have to just spend time with the baby, holding baby in your arm, cuddling, playing with the baby, making some voices, babbling. If you are cooing, reciting some poems, all these things will help baby to come close to you. As soon as whenever you are doing some even gentle touching, sensitively touching the baby, and skin to skin contact, all these things are very essential, both for the growth of baby also, as well as for very strong relation between bonding between the mother and baby. And it is also advised that you swaddle the baby properly. Swaddling is just like you are covering the baby adequately, and in that case the hands are close to the body, so baby is feeling more secure and safe, and the legs are free to move because they enjoy moving their legs. So you should not swaddle them too tightly. It is always advised that it should be lightly swaddled so that they feel safe and secure. If you keep them without any wrap or without any swaddling, they will feel that they may fall because there is a startle reflex. They will suddenly, to a sound also, they will reflexly get. They will make some movement which will be like they are astonished. Okay, so it is always better that you properly wrap them. They feel safe and secure that they will not fall from there, and that again helps to be make baby relax. So whenever the child is relaxed and not in some anxiety, it will be good for the development of the baby. They will feel more safe, secure. They will be growing better. Brain will be growing better, and they will be crying lesser. So these are the things that we should take care. Regarding using diapers, it is advised that you can use both cotton diapers as well as the disposable ones. But it is important that you change it after every time it is soiled, and so that it is not the baby is not in the wet diapers or soiled diapers for a longer time, because that will cause some diaper rashes. So for that, you should keep some diaper free time. Keep it open for a few hours, a few minutes, or a few hours in between, rather than using it on a continuous basis. And while cleaning, also, it is advised that we should not clean it very like it should be very gentle cleaning, so that there is no rashes as such. And cotton clothes is definitely better as compared to wipes. You can just soak some cotton in the water and just clean it with soft hand. And especially in female babies, we should clean from front backwards, so that there is less chance of urine infection in the newborn babies. And so these are the few things. I have tried to cover most of the things, so that whenever you should know that what all are the normal things, and you should not worry about all these things. So I don't think we have any other question as such. So this covers most of the things which we should be knowing about the newborn care. So thank you. We'll be looking to meet you again with some other topic, and which can be beneficial to you.